This Focus on Health segment is brought to you by Aurora Health Care.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're going to be talking about a subject that's quite frankly not very easy to talk about. It's female incontinence. And we're going to be speaking with Dr. Shawn Laibly. He's an OB/GYN here, and he's going to be talking about some of the treatments and some of the causes of female incontinence. Well, thank you for taking some time with us today, and this can be a very sensitive issue, but let's talk about, what exactly is female incontinence?
Female incontinence is basically the inability to hold your urine. There are otherwise, you cannot control when you have to go to the bathroom. Sometimes people will just lose urine when they cough or sneeze. And it can be very debilitating.
Yeah. Are there different types of incontinence?
There actually are, and that's one of the most important things for physicians to figure out when someone comes and says, I'm leaking urine. The two main types of incontinence are overactive bladder and then genuine stress incontinence. Overactive bladder is basically the bladder's inability to control itself, and it's in a constant state of contracting, and it makes people feel like they have to use the restroom all the time. It can be caused by a number of things. And then genuine stress incontinence, which is the loss of urine with coughing, sneezing, lifting, running, and sometimes just getting up to go to the bathroom, people will lose urine.
Yeah. I would imagine there are different causes for incontinence. What are some of those causes?
Yeah, absolutely. One of the most important things that we have to do is figure out, what could be leading to the loss of urine. Sometimes people are just born with bad genetics, and later on in life it can lead to an overactive bladder. Sometimes people just drink too much during the day. They'll drink too much water, or they'll drink too much coffee or soda. It's very irritating to the bladder, and it'll make them feel like they have to go to the bathroom all the time. It can be related to, specifically stress incontinence, it can be related to childbirth. Just the trauma that the pelvic floor undergoes during birth can cause some damage to not just the muscles and the connective tissue, but the nerves that can be long lasting.
Yeah. Now, if a person is dealing with incontinence, what are some of the treatments or remedies that you can recommend?
There are a wide variety of treatments. There are a variety of medications that people can take for overactive bladder. These have some side effects, and so you have to be careful with this. Physical rehabilitation, physical therapy, there are a lot of exercises that women can be taught to help strengthen the pelvic floor and help improve and control the timing of urination. And then there's some surgery that can be done to help control the loss of urine when it's stress incontinence.
Yeah. When you talk about the physical rehab, what can a woman expect in physical rehab for incontinence?
Yeah. Physical therapy involves strengthening the pelvic floor muscles. And just like exercising, it takes a long time for that to happen. These are not just your routine Kegel exercises, but involves other muscles in the pelvic floor to help control the sensation that you have to go, and just the ability to help hold back when you feel like you have to go.
Would surgery be a quicker option, and what can a person expect if they take the surgical route?
Yeah, surgery can be. Actually, there's a procedure out there called a transobturator sling. The sling procedures have been around for many years now, but this has really become the gold standard treatment for genuine stress incontinence. Before surgery, there's another option that people might have. It's non-surgical. It's called a pessary. Pessaries are ring-shaped objects. They're made out of like a soft rubbery material. They come in different shapes and sizes, and they basically sit inside the body and help compress the urethra, which is the tube that takes the urine from the bladder to the outside world. And by compressing that, it prevents urine from leaking out. Again, it's not perfect, but sometimes it can really help control quality of life. The sling procedure is a very straightforward, about a 20 to 30 minute procedure that provides a backstop for the urethra, so that when someone coughs or sneezes, it applies pressure then to the urethra, and again prevents urine from leaking out. It's very effective. The 5-year, 10-year data that has been coming out in these procedures is well over 90% effective. with long-term effectiveness.
Yeah.
And
So, I mean, completely stopping the incontinence.
completely stopping the incontinence for a lot of people. You know, again, the most important thing is that we can't make the system perfect, but if we can get someone to where they don't have to worry about crossing their legs every time they cough or sneeze, or they can take a walk around the block and don't have to worry about losing urine when they're walking, we've done a significant benefit to them.
Yeah. And most women will probably experience incontinence at some point in their life.
You know, a lot of people do, Ted.
Yeah.
And really, that's one of the most important messages, is that this is really embarrassing for a lot of people. And it's tough for women to talk about this issue with their physicians, or with anyone, even with their friends sometimes. But one of the most important messages that I'd like to give out is that talk to your physician if you feel like this has become a problem for you. You know, it may take a visit or two for you to build up the confidence to do that, but go ahead and do that, because if your physician can't do something for you directly, hopefully they can get you into someone who has the ability and the skill set to provide some relief for you and improve your quality of life.
Great advice. We appreciate you taking some time with us today.
Thank you.
Now, you may have some questions or concerns about this topic. You can always contact your primary care provider, or you can give Dr. Laibly a call at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Health Care.